I'm Gayle Guyardo. Welcome to Bloom, presented by Lifeguard Imaging, a full hour dedicated to your health and wellness. Get ready to bloom. We are exploring a new health trend happening nationwide and in Tampa Bay, including a breakthrough test that takes just minutes to discover and treat acid reflux that, if left unchecked, could lead to severe health issues. Joining us now is Dr. Sharona Ross, an advanced foregut and HPB surgeon with Advent Health Medical Group. Dr. Ross, as always, it's such a pleasure to see you.
Same here. The pleasure is all mine.
So today we're talking about things to look out for in 2023, and there are millions and millions of Americans that suffer from acid reflux, and they're just out there popping the antacids and going on with life, but it's very dangerous. There could be something underlying that's serious, and you have advanced treatment that a lot of people don't know about.
Yes. So first of all, chronic acid reflux, as we know, it's like 1 in 5 Americans that suffers from it. And that's, like you said, people that many more not going to the physician, but going to the pharmacy and getting some anti-reflux medication. So the problem is humongous. Chronic acid reflux, we know now, is a precursor to Barrett's esophagus, which is a precursor to esophageal cancer. There is a new test that came out actually in 2020, the FDA approved it. And it's a test that can not replace, but be adjunct to endoscopy. Now, we know in the past 4 decades, the incidence of esophageal adenocarcinoma increased 733%.
Wow.
So it's a lot of people that are now suffering from esophageal cancer. But less than 10% of high-risk chronic acid reflux patients get the surveillance or the screening endoscopy, which is a problem. So you're missing all those. I mean, that's a disease that can be completely preventable.
Really?
You can erase esophageal adenocarcinoma if you appropriately treat chronic acid reflux. So this new test is called EsoGuard. So before if you have chronic acid reflux, you have to go to the gastroenterologist, make an appointment, then take a day off of work to get the endoscopy and get anesthesia and all. Right now, there's a test it's a small little catheter with a balloon at the end of the tip, and it's the size of maybe a vitamin pill. And you swallow it within like 3 to 5 minutes. The test is done. We send it collects some cells from the end of the esophagus. We send it to the lab, and within 2 weeks, you know whether you have Barrett's esophagus. It looks for DNA changes, abnormalities that are consistent with Barrett's esophagus. So if it comes back positive, you then go to the gastroenterologist, get the endoscopy, get the biopsy, and confirm the diagnosis. But unless you know that you have Barrett's, you may progress to cancer, not even knowing that you really should do something preventative or definitive treatment for acid reflux. If you treat acid reflux definitively, you can eliminate the risk of having esophageal adenocarcinoma.
Now, I know that you are a leader in this field, not just here in the Tampa Bay area, but nationwide. So talk to me about the treatment protocol, because again, if you can catch this early with a test that just takes minutes to do, it's non-invasive, there's no downtime, then you can step in and start helping patients.
Correct. So instead of keep on taking pills, if you find yourself taking more than a few times a week anti-reflux medications, go to your primary physician. Ask to be seen by a gastroenterologist. Get a scope if you can. If you don't want to get a scope, at least get the EsoGuard and get tested. But doing the true preventative is endoscopy with Bravo pH. It's a little chip that they'll place to determine how significant is your acid reflux. If it's truly significant, after you did all the lifestyle modifications, and if you're overweight, you lost the weight, you avoid the specific food that you know will cause you trouble, if you did all of that, if you still find yourself taking medications, get the endoscopy, get the Bravo pH, and really figure out whether you have significant acid reflux. If you do, demand to see a surgeon, a foregut surgeon that specializes in upper GI, and there's specific operations that are useful that can definitively treat acid reflux, so you'll never have to worry about esophageal cancer.
That's amazing. And I know the Advent Health Digestive Institution Tampa is home for the Mickle Center for Reflux Esophageal Disorders. So this is something that's right in our backyard.
Correct. correct. And we do it all robotically, very minimally invasive. Patients do very, very well. And we follow them throughout. So it's not like you come in, you get your operation, and then we say goodbye. We actually follow to make sure you never have again to worry about reflux.
And you touched on something that's near and dear to my heart, and that is your expertise in robotic surgery. I know my late father was a patient of yours, and I remember he had to have very serious surgery. But for a man well into his 80s, he did incredibly well because of the advancements of robotic surgery. Again, you are a leader in our community doing that, but it's becoming more and more common and something to watch out for in 2023.
Correct, correct. And we work really hard to not just advance robotics with a whole spectrum of operations, but really work with industry as they develop now the single port robotics to apply it safely to other operations. So right now for, let's say, esophageal cancer or pancreatic cancer, I do multiple small incisions robotically. I'm hoping to be able to do it through one small incision, entire operation that is not more than 2-centimeter incision, which before we used to do when I was trained was all open operations. During my experience and career, I worked with small incisions, but I want to end my career one day.
No time soon, we hope.
One day,
with the
single small incision, or maybe none. You never know. I love technology.
I know you do, and we love you, Dr. Ross, and I know what a busy doctor you are, and it means the world to me that you would take time to come and join us on Bloom.
Well, thank you for the invite, and as always, it's great to see you.
Thank you so much. And to find out more about Dr. Ross and ESOGuard, just head to our website, wfla.com/Bloom. And when we come back, the update on the fight against fentanyl. You're watching Bloom, and we'll be right back. You're watching Bloom.